This is Andrea Kane, and I'm here with you for HIT 352 Health Information Systems. We are now on week 12, and we are on chapter 12 in our textbook, looking at standards. If you take a look at your syllabus, you will see that we're still on learning objectives 9.2.1 through 9.2.7, and 9.3.1 through 9.3.3, and 9.4.1 through 9.4.7. We will come back to these learning objectives again on week 14, but after that we have, between that and after that, we have different objectives that we'll be looking at. So this is sort of the end for those. If you want to follow along in your textbook, we are starting chapter 12 on page 203. So if you want to turn to your textbook, you can do that. Our learning objectives, according to the book, are to talk about the necessity for standards in health information technology, look at HL7 and how that influences health data standards, clarify the difference between the continuity of care record and the continuity of care document, because they're two sort of different things, compare and contrast data content standards, vocabulary standards, and messaging standards. We'll also be looking at how SNOMED works to achieve uniform terminology. We'll look at the need for data mapping. We'll look at NDCs, which are National Drug Codes, RX Norm at the National Council for Prescription Drug Programs, also known as NCPDP. So let's talk about standards. What are standards? They're a scientifically based statement of expected behavior against which structures, processes, and outcomes can be measured. They should be technology neutral and not rely on any one type of technology to work, meaning that it shouldn't be vendor specific. It shouldn't be that you have to use a certain piece of technology to make it work. A standard should be across all technology, across all vendors, and again, should work to create this expected behavior regardless of where you're coming at from it. And again, you have to be neutral to implementation processes, which vary widely. Public and private partnerships. Public to private partnerships are one way governance issues can be addressed and resolved. And you'll see that as we move forward, that there's quite a few when you're talking about health information technology where public-private partnerships have been created and are very effective when it comes to standards. So what is a public-private partnership? It's a contractual arrangement between a public agency, meaning federal, state, or local government, and a private sector entity. And that could be a hospital, it could be a company, it could be a vendor, all sorts of things. So that's where you get the public-private piece. Through agreement, skills and assets of each sector are shared in delivering a service or facility for use of the general public. Each party shares the risk and reward potential in the delivery of the service and/or facility. Standards development organizations, also known as SDOs, are private or government organizations that create or approve standards at the national or international level. And we're going to talk about several of those as we go through your book. There are lots of these SDOs for HIT and HIEs. However, standards developed by different health HITs and HIE organizations may overlap or compete with each other, and that's a challenge that we have currently where we're at with the evolution of EHRs and interoperability. But standards are to allow smooth exchange and incorporate data from all sites, vendors, and specialties across the healthcare continuum. That's the ideal, and that's where we're headed with all of this. But unfortunately, sometimes that leaves healthcare organizations struggling with interoperability issues. The first one we're going to talk about is the International Standards Organization, the ISO. It is a large, widely recognized international SDO that has established many standards for EHR architecture and content across the world. And typically you'll see that each country has an SDO that they send to the International Standards Organization on behalf of that country. Anyway, the ISO has established many standards for EHR architecture and content. They have more than 22,000 standards for technology and manufacturing. It takes approximately 3 years for the ISO to review and approve a standard. So this is not a quick and easy approval process. Some general areas of standards for HIT include vocabulary terminology, transport messaging, security, content, and technical. And I will tell you, you need to know this for your quiz, hint, hint, hint. So what is vocabulary terminology? If you're following along in your book, we are at the top of page 205. Vocabulary terminology is a specific set of values for a specific data type. Transport messaging is how information is sent and exchanged between systems. Security is providing assurances that the messages are protected. Content means it identifies which data elements are included, where they're located, data type, field length, and so on. Technical means it's usually a formal document that establishes uniform engineering or technical criteria, methods, processes, and practices. So make sure that you know the contents of this slide because you will need it come the end of the week. All right, so what is the group that is the SDO for the US? It is called the American National Standards Institute, or ANSI, ANSI. ANSI is our representative again to the ISO. They don't develop standards, but they provide a neutral environment for organizations and entities to work together to settle on common agreement for standards, such as the format, contents requirement, that sort of thing. So they're there to represent us to the ISO as a country, and then of course they bring back what the ISO has approved and try and get that disseminated out and implemented. Before a standard can be approved, it has to meet the rules of ANSI and the following requirements. They want it to be made from consensus. It has to go through due process. There has to be an openness or a transparency, and then a balance. It has to protect rights and interests of all members, so it has to be balanced. The ISO has developed a 6-step process for organizations that request approval for specified standards. And these 6 steps are proposal, preparatory, committee, inquiry, approval, and publication. And this just goes through and shows you what it is. So essentially you agree that there's a need for a standard, then you draft the proposed standard. The draft is analyzed and reviewed by a committee until consensus is reached. Proposed standard is then available for review and comment by all stakeholders. The final draft is then voted upon for approval, and if it is approved, it is published. Another well-known standards development organization is ASTM. And ASTM is also an international SDO. Its healthcare aspect is only in the United States. It's typically, ASTM really focuses on industry, but when it comes to the US, they also do have a healthcare aspect. The US division is called Committee E31, and that addresses standards for healthcare data management, privacy, confidentiality, and security, as well as data analyses and information capture and documentation. The goal is to help practitioners preserve and transfer accurate patient information using EHR technologies. So that is why you need to know about ASTM and Committee E31. All right, so now let's talk about data content standards. These are clear guidelines for the acceptable values for specified data fields. These standards make it possible to exchange health information using electronic networks, and they identify the structure and content of data elements to be collected by the EHR. Data content standards allow organizations to collect data once and then use it many times in many ways. They also assist in data storage and mining, data mining, as well as sharing data with external organizations for use in benchmarking and other processes. The use of data content standards also assists in the HIE process. And this is on page 206 in your book. So what is HL7? Because if you've been around EHRs at all, you have heard of HL7. It stands for Health Level 7 International. It was founded in 1987 as not-for-profit ANSI accredited SDO. They are dedicated to providing a comprehensive framework and related standards of electronic health information that supports clinical practice and management, delivery, and evaluation of health services for exchange, integration, sharing, and retrieval. So HL7 is really focused on exchange, integration, sharing, and retrieval when it comes to health information. They have developed standards for the electronic exchange of clinical documents like discharge summaries, progress notes, H&Ps, consults, operative reports, and it's referred to as Clinical Document Architecture, or CDA. CDA uses HL7 XML-based document markup standards for the electronic exchange model for the creation of clinical documents. So that is what HL7 does, and this is drilling down to specifically how that impacts the electronic exchange of clinical documents. There are implementation guides included with each standard, and they define how to use specific standards for specific purposes. This implementation guide is meant to remove optionality. It states what data elements are required and when, so there's no room for interpretation, confusion, or substitution. ASTM International created the CCR, Continuity of Care Record. This identifies a core data set of patient information that has to be passed on to the next healthcare provider to efficiently and effectively continue the patient's care. So you're thinking continuity of care. It's that information that's needed by the next healthcare provider. The CCR, again, this core data set, was designed for all patient referrals and transfers. And it contains document identifying information, patient identifying information, insurance and financial information of the patient, patient's health status, care documentation and care plan recommendations, advanced directives, and a list of healthcare providers that have been involved in the care of the patient. And this is information you need to know. Okay, that was a continuity of care record. What is a continuity of care document? That is an implementation guide for sharing CCR patient summary data. It's a result of joint effort between ASTM International and HL7. It fosters the interoperability of clinical data, meaning that it allows physicians to send electronic medical information to other providers without loss of meaning, and enables improvement of patient care using the HL7 version 3 clinical document architecture release 2. So the continuity of care document is the implementation guide for those who want to be able to share a CCR, share or receive a CCR. The CCR, the continuity of care record, is the information that's going to be exchanged between healthcare providers using this ASTM International and HL7 standard of continuity of care transmission. So moving on to vocabulary standards, we're now on page 207 in your book. Vocabulary standards are a list or collection of clinical words or phrases with their meanings, and they address the problem of multiple ways to define, classify, and represent language. Medicine has its own language. There are many terms in medicine that can have multiple synonyms, and the use of these synonyms can make it difficult to identify patients that have a specific disease or condition. Several terms fall into the concept of vocabulary standards, including language, vocabulary, terminology, and nomenclature. So let's talk about those, because you'll need to know these. Hint, hint, hint. Language is a system of communication used by a group of people. Vocabulary is all the terms that are used for communication within an area of specialization. Terminology is the words that are used for a specific purpose, and nomenclature is a system used to assign names. So make sure you know all of these, that under vocabulary standards, it includes language, vocabulary, terminology, and nomenclature, and make sure that you know what the meaning of language, vocabulary, terminology, and nomenclature are. So each term included in the vocabulary should have a unique meaning. Terminologies and vocabularies can have overlapping terms due to synonyms and eponyms. One of the most challenging aspects of medicine and application of EHR and diagnostic software to interpret unstructured and sometimes structured text from healthcare providers. It is the fact that you can have these overlapping terms. So we get to SNOMED. What in the world is SNOMED? It is systemized nomenclature of medicine clinical terms. So SNOMED CT. It is the most comprehensive, multilingual clinical healthcare terminology in the world. It contributes to the improvement of patient care by underpinning the development of EHRs that record clinical information in ways that enable meaning-based retrieval. SNOMED, again, is a nomenclature. So it's not something that you go in and it's not a classification system. It's not a coding classification system. It's a nomenclature. It's used for the EHR for research and clinical decisions. It captures items such as diagnoses, procedures, signs, symptoms, and cause of injury. It has a concepts table that consists of more than 344,000 concepts, 450,000 medical descriptions, and 700,000 concept interrelations, each of which has a unique meaning and format definition. It also contains description tables with more than 1 million language descriptions or synonyms, and a relationship table that contains over 1.3 million semantic relationships. These relationships are important to data retrieval. We will come back to SNOMED with some other things, but you just really need to understand that it's a nomenclature. Now we're going to move on to LOINC. Logical observation identifiers, names, and codes. Anytime you see LOINC, you're going to think lab data. It's the preferred standardized terminology for lab data in information systems. It provides a standard set of codes and names for electronic reporting of lab results. It has been expanded to include observational data such as vital signs and is used for standardized assessments and care plans in long-term care and home health. So please be aware of this information. RxNorm. This is a clinical drug nomenclature that was developed by the FDA, the VA, and HL7 to provide standard names for clinical drugs and administered dose forms. It is a non-proprietary system, and it provides standards for drug ingredients and strength, dose formats, drug properties, physiological effects, and therapeutic category. And this is on page 208 in your book, toward the bottom. So please note this information as well. Now we're moving on to UMLS. UMLS stands for Unified Medical Language System. This was developed by the National Library of Medicine. It was originally designed to build an automated system that can understand biomedical concepts, words, and expressions and their interrelationships. It now includes concepts and terms from many different vocabularies. Two key concepts of UMLS are semantics and syntax. So make sure that you know that when you think of UMLS, think of semantics and syntax. And you need to know the definitions for semantics and syntax. Semantics is a branch of linguistics that deals with the study of meaning, including the ways the meaning is structured in language and how changes in meanings and form occur over time. Syntax is the study of patterns of formation of sentences and phrases from words and the rules for the formation of grammatical sentences in a language. I don't know if it's gonna, no, it doesn't. Hang on. When we're on UMLS, note in your book that the UMLS uses knowledge sources to help retrieve data across many databases. These knowledge sources are, and this is something you need to know, the Metathesaurus, the Specialist Lexicon, and the Semantic Network. This is at the top of page 209, at the very end of the first paragraph. So the knowledge sources in UMLS that you need to know are the Metathesaurus, the Specialist Lexicon, and the Semantic Network. Make sure that you know those three. Moving on to National Drug Codes, NDC. These were developed by the FDA to act as a universal unique identifier for human drugs. Notice that human drugs doesn't include animal drugs. NDC identifies a labeler or vendor, product, and trade package size. And they give you, at the bottom of page 209, there's table 12.1 where they give you examples of national drug codes. So you can see those. Current dental I'll try and get that out here. Current dental terminology, CDT. This is used to code dental procedures such as tooth extractions, tooth implants. It was developed by the ADA, American Dental Association. It also includes diagnostic, preventative, restorative, endodontics, periodontics, and other dental procedures. It's their coding terminology, and it's used for billing purposes. Medicine. This is a nomenclature and knowledge-based system. It was developed by Peter S. Goltra and is now controlled by Medicomp Systems, Inc. It is the most comprehensive vocabulary for signs and symptoms. It includes 250,000 clinical data elements that fall into the categories of symptoms, history, physical exam, tests, diagnoses, and therapy. So make sure that you are aware of that information. It's at the top of page 210. Moving on to DSM-5, Diagnostic and Statistical Manual of Mental Disorders. This was developed and published by the APA. Current edition is 5, as I said, DSM-5. It is a classification system of mental disorders used by mental health providers. It assists physicians in properly diagnosing patients with mental health conditions. Please note that DSM-5 has ICD-10 codes integrated into it. And it provides detailed and specific criteria and information for physicians to accurately diagnose mental disorders of patients. So what is mapping, data mapping? It's a crosswalk between the various terminologies that has to be created, and it allows for interoperability. It is the process of associating concepts from one coding system with concepts from another coding system and defining their equivalents in accordance with a documented rationale and a given purpose. Some of the categories that you're going to run into are used in mapping. There's such a thing as one-to-one. An exact match is made between the systems. Another one is narrow to broad. This is a more granular term in the starting system that maps to a more general term in the receiving system. Then you have the opposite, which is broad to narrow, where you have a more general term in the starting system, and that maps to a more granular term in the receiving system. And then, of course, there are the unmappable, when there is no matching in the receiving system. GEMS, General Equivalence Mappings, were created by CMS and were used to convert ICD-9 CM codes to ICD-10 CM and PCS codes, or the reverse. They go back and forth. They're available still to this day. You can go back and see them if you're that curious about those. Messaging standards. This is at the bottom of page 211. These may also be called interoperability standards or data exchange standards. So make sure that you note that this can have three names: messaging standards, interoperability standards, or data exchange standards. And the purpose of these standards is to support communication between information systems. With messaging standards, proprietary systems are able to talk to one another, allowing the exchange of data. For instance, Cerner and Epic. Standards do this by mapping proprietary forms to other formats. Existing standards have allowed for flexibility, which has caused problems with the interoperability between systems. EDI. What is EDI? It's electronic data interchange. And this is the concepts that you're seeing in this chapter. Some of them are specific to healthcare and some are not. When it comes to EDI, it is a business transaction. It is not a healthcare transaction. It's a business one. So as we move on to EDI, which is on page, let's see here, bottom of 211, heading into the top of 212. ANSI, with their subcommittee, their insurance subcommittee, developed messaging standards for electronic data interchange, or EDI. This is the exchange of routine business transactions from one computer or information system to another in a standard format using standard communication protocols. And an EDI was adopted by HIPAA transactions and code sets. So this is the standard for many of the transactions that happen that are covered by HIPAA, such as claims eligibility inquiry and response, claims status inquiry and response, and payment and remittance advice. So please notice that's why EDI is mentioned, is HIPAA also adopted it for healthcare, and that's where they're using it, is for those items. And some examples of messaging standards include HL7, DICOM, NCP/DP, among others. So what is DICOM? DICOM is Digital Imaging and Communications in Medicine. This standard retrieves images and other information from imaging equipment from many vendors. So when you see DICOM, you want to be thinking imaging. You want to be thinking PACS system, radiology, digital imaging. It covers message exchange, data dictionary, data structure, and coding. It started out in diagnostic medical imaging, radiology, but it's broadened to include specialties like cardiology and dentistry as well. Other places that diagnostic imaging is used. And those images need to be transmitted between systems. And they're also, so we talked about this. Yep, sorry, we went through this about how messaging standards for specifically EDI then were adopted through HIPAA, transactions and code sets, and applied for health insurance administrative transactions. NCP/DP. This is the National Council for Prescription Drug Programs. It's an independent SDO and is ANSI accredited. These standards were developed for and used by retail pharmacies and payers for claims eligibility and remittance advice. These e-prescription standards are called script and control data to be shared for new prescriptions, refills, and other communications between physicians and pharmacies, and is regulated under the Medicare Modernization Act of 2003. And that is it for chapter 12. But there's a lot of detailed information in here, so be sure that you, if you're not sure about the terms or the concepts or what have you, take a look through, read through your book, highlight it, go back. There might be something in the back in the glossary that can help you, but make sure that you know some of the details behind these and are definitely able to identify the abbreviations for a lot of these. All right, take care. Hope you have a great week, and I'll talk to you again next week, and we'll be on chapter 13.